Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
This is Dr. Candace Pierce with Elite Learning by Calibri Healthcare, and you are listening to our Elite Learning podcast, where we share the most up-to-date education for healthcare professionals. Thank you for joining us for this podcast series topic, Concussions in Children and Adolescents. And today I'm joined by Dr. Sally Fryer-Dietz, an internationally recognized physical therapist specializing in concussion therapy, founder of Integrative Concussion Therapy. Sally, thank you so much for joining us for this timely podcast.
Thank you.
Yes, I'm so glad that you're here today. I wanted to talk a minute about why this podcast topic is so important. Currently, specifically in the U.S. for adolescents and children, we have about 44 million youth who participate in sports every year. And of the concussions that we know about, we have approximately 1.1 to 1.9 million sports-related concussions that occur each year. Of course, you don't have to be playing in sports to have a concussion either. But it's so interesting to me that we have so many concussions in our youth, yet the majority of the research takes place in your high school and collegiate age group.
Right.
Why do you think that is?
Well, it's because we have screening procedures in place in high school. So when you participate in organized sports, if you have a concussion, it gets recorded. Unfortunately, for the younger kids, you don't have that luxury. Most of the sports aren't monitored. A lot of concussions go undetected. Parents don't really know what to do. They go home, they put them to bed or whatever. And so you miss out on all those. The only ones you record are the ones that go to the emergency room.
Well, let's start with, what is a concussion? And I know I've seen some debates where people have debated, is a concussion a TBI? So can you kind of walk us through, what is a concussion? How does it fall into that TBI scale?
Okay, so all concussions are TBIs. They're mild TBIs. It's a traumatic brain injury. And what it is a reflection of is a metabolic shift that goes on in the brain. There are different changes that can occur that affect your vestibular system, your visual system. It can affect, how you think and process information. So there's a lot of different factors that are involved to diagnose a concussion, but they are considered a TBI.
So you don't have to necessarily be hit like full contact sports. What are some ways that they can actually have a concussion?
So it's really interesting. One of the myths about a concussion is you think that you do have to hit the head. But in fact, you could fall off a playground and land on your bottom and suffer a concussion as well. You could be in a car accident and have a whiplash injury. Just the mechanism of the head moving fast through space, where the brain actually gets hit against the skull bones, can cause that metabolic shift and cascade.
Why do you think that so many people don't necessarily correlate a concussion is a TBI?
When you say TBI, people think of somebody who's severely impaired and can't walk or can't move or can't talk, a severe head injury that requires long-term
like
rehab.
Military.
Right.
I really
TBI,
think of the
blast
military
injuries,
right.
All that kind of stuff fall under TBI. So it's, we talk about concussions just because that's kind of the popular term that is used to discuss sports injury in particular.
I think the term TBI sounds scary. It sounds
scary,
probably more scary than the term concussion, because I remember growing up as a child, concussion wasn't really that. I mean, you went home. You didn't have any follow-up evaluation, and you went home. And TBI just seems to be so much more serious. But really, concussions are serious.
They absolutely are. And, over the last 10 years, we've been able to shed light on that and actually, prove that they are serious, especially in the young child, because they're growing and developing. And what makes them especially tricky is that it can take months for even an adolescent or an adult to recover, but for young children, it can actually, the effects of a concussion can show up even years later. So, identifying it early is critically important. But, before 10 years ago, when there was this whole, it was almost a machoism about getting a concussion.
Right.
Well, how many concussions did you get playing
Right.
football? And oh, I had tons of concussions. And I've worked
Yeah.
with a lot of professional athletes, and I'll tell you, the most common story that I would hear is that their worst concussions they got were when they were kids.
Oh, wow.
And you know, it's interesting, and yet a lot of the problems that they're having today is that it's not just that 1, 2, or 20, but it's the number over their lifetime. It just keeps magnifying.
So the thought with a concussion is that you would see some type of neurological decline or in their functioning pretty much right after it happened, but that's really not necessarily true, correct?
It doesn't have to start that way. However, we do have sideline assessments that are very good at looking at those things, because if you've had a fairly significant concussion, you're more likely to have changes in your balance system, your visual control, your immediate recall. There's different tools that we can use to help screen out if somebody's had a concussion or not. There's really no one test that can diagnose a concussion. So you can't just go out there and ask questions, and if somebody answers them appropriately, assume that they did not have a concussion. And that's, again, why it's so dangerous, especially for the younger athletes, because they can slip by, and then the next day they're waking up with a headache, or maybe it's 2 weeks later, they can't really think, they can't do their schoolwork. And unfortunately, if they get put back in sports too soon, within those, especially the first 2 to 3 weeks following a concussion, if they have a second injury on top of that, which is when they're most susceptible, it can again magnify it. You have to think of it in your brain. It's like you have these little filaments, and with each concussion, they sort of break apart. So the first one, maybe it's like this. The second one, maybe it's like that. The third one, that
Maybe it's
doesn't go back
broken.
together. Yeah. So,
So
it's
they
tricky.
go back together when they heal, or is it just it's broken?
No,
Those
they really
filaments.
are. They're broken. I mean, those connections are broken. You can rehabilitate, and especially if you get them early. And that's why it's so important to identify a concussion early. For kids who are at high risk for a prolonged injury, and we'll probably talk about that in a minute, you want to get them into some kind of a rehab program, meaning a concussion specialist who's helping to guide that recovery, so that they can really maximize all of their other brain function. The brain is amazing at being able to accommodate and make corrections, but the actual cells themselves, once they're broken, you really have to develop new pathways to accommodate for that.
Right. Now, I was reading and it said that a lot of times the recommendation is that you have a medical clearance to go back to sports, but you don't necessarily have to have a medical clearance with a concussion to go back to school.
Well, it's most of the school protocols, you're correct, they don't have that in place.
Hmm.
However, there is a progression of, if you have a diagnosed concussion, the physician, who's the only person who can diagnose a concussion, um, should be giving guidelines as to when to reintroduce activity. And learning or being in school is just as taxing on the central nervous system and your brain in particular as sports. So
Right.
that's something
Makes
that,
sense.
because your eyes are having to work, your balance systems, you've got lots of sounds in the school, you've got bright lights, a lot of times they're flickering lights, a lot of things that can exacerbate symptoms. So if you have an advocate or somebody who's, at least guiding you, you can kind of touch base on what those symptoms are and really monitor what's the just right activity for somebody. For some kids, they may be able to go back to school and have no symptoms. Your symptoms really are your guide. for other children who might have even looked like they had an even less severe injury, it just could stir up all kinds of trouble.
So let's go backwards a little bit and talk about symptoms. What types of symptoms do you see in adolescents and children with concussions?
So there's a whole variety of symptoms that you can see. The kind of the hallmarks for the big ones. If you have immediate dizziness, that's a big red flag for a potential prolonged recovery. If you have, any kind of balance dysfunction or vestibular issue where they're unsteady on their feet, that's another big one. Um, Cognitive impairment, they can't answer questions about uh, where they are, what game they're playing, what quarter it is, what was the score yesterday. Can they count backwards from 10 to 1? Some just kind of
Right.
very generalized cognitive tasks.
Mm-hmm.
That can be a big red flag. All these things together can signal a concussion. Those are sort of your immediate things you might see. You could have a child or an adult, anybody that could throw up. They don't have to though. They could become unconscious. We used to think that if you're unconscious, that meant you had a really severe concussion. It could be, but they also now found that kids, or individuals who are go unconscious, it may be almost neuroprotective in some way. So
Oh,
a lot of those kids end up recovering just fine, whereas again, somebody else who had kind of these prodromal symptoms going on might have a much harder time of recovery.
that's so
The,
interesting what you said about going unconscious. I never would have thought of that as a protective mechanism.
right, right. So that
Mm.
the central nervous system does it as good of a job as it can, but we can't
Right.
abuse our bodies too badly, or else we really run into trouble. Some of the other
Absolutely.
symptoms, that you can have over time are, especially with kids in school, they may have difficulty keeping up with their schoolwork. They might have light sensitivity or noise sensitivity. They may be easily distracted. Um, that often can lead to, symptoms of anxiety and depression. Um, Concussions they're not simple at all.
It's very multifaceted because a lot of the things that you're saying for like the long term anxiety, depression, you really don't correlate those to a concussion.
Right,
You would correlate them to something else, but maybe that is something that needs to be screened. Is if you have someone struggling with anxiety, depression,
right.
attention disorders, do they have a history with concussions?
Yeah. And actually, that brings up a good point about what are the pre existing conditions for having a longer or harder recovery. And the big ones are number one is the diagnosis or symptoms of a learning difference or ADHD, depression, anxiety, any kind of an anxiety disorder. Um, those are all, you know, those kids are set up to have trouble. And if you have that kind of history, it's really to that child's benefit to have a concussion specialist guide them through their recovery. Uh, because if you do too much following a concussion, or if you do too little, then that can prolong that recovery for that individual. So it's hard for people to know what's too much or too little. And then we, complicate things with age and social peer pressures and all kinds of other stuff, and it can make it a challenge.
Absolutely. I want to talk a little bit about myths around concussion. I want to start with one that I think most people have heard. When I was young, I had what they thought was a concussion. I was on an elementary school playground. Me and another girl hit head on, had passed it and knocked us out. Had huge knots on our forehead. We went home. And one of the things that I remember from that is they woke me up every hour on the
Right.
hour.
That's how they used to do it. And if you think about it, sleep is so important. And just like being unconscious, maybe neuroprotective. If you need to
Hmm.
sleep, you need to sleep. Um,
Right.
the reason they do that And, initially it's important to keep an eye on what the symptoms are and certainly look at the pupils. Any sign of becoming increasingly disoriented or having where it just seems like it's not moving in the right direction could potentially be a sign of a bleed, and it could be a slow bleed. So, in that case, we don't want somebody to kind of just, drift off into unconsciousness. That would not be normal at all. But just, they're, sleeping, breathing comfortably, and just need to rest. That, you know, that's appropriate for them.
So, do we need to wake them up?
No, you do not need to wake them up.
So we can let them sleep.
Yeah, but don't just take somebody home and an hour later put them in bed to go to sleep. You need to kind of keep an eye on them at least through that acute phase. Make sure they get something appropriate to drink, not sports drinks, because that adds to the whole metabolic shift of sodium in the brain. So we want to give them water to drink. They might be hungry. Give them some healthy proteins, healthy fats, that kind of thing. And certainly even throughout the whole recovery process, having that appropriate diet to feed the nervous system so that it can heal. It takes a lot of calories to recover from a concussion.
What would you consider the acute phase? What is there a time frame for that?
It's typically, the acute phase right immediately after the concussion would be, the first couple hours after a concussion, for sure. 2 to 3 hours, something like that. But you kind of, it's okay to check on somebody, but if they look comfortable, they're breathing, normally, they're just tired, because it's a big insult on the system.
Right.
It's good to let them sleep.
All right. So what are some other myths?
Well, back in the old days, they used to think, if you got your head hit, it was just like getting your bell rung, or they had all kinds of different sayings for it, and that's not a big deal. The losing consciousness was a big one. They used to think that you could only have a concussion if you threw up afterwards. And some people do, but a lot of people don't. Most people don't.
I wonder what started that. Oh, you have a concussion because you threw up after you got hit.
I just think because people look, like
it's abnormal.
They don't feel good. And, so those are kind of your bigger ones.
Amnesia? Or amnesia, not remembering
is a red flag for a concussion. So that's certainly important information. The difference between a sports-related concussion and a concussion that might have happened in a motor vehicle accident or a playground or somewhere else is that typically in a sports-related concussion, it is observed. You can see the hit. You see what happens. You see that person initially on the ground.
You hear everybody gasp
and kind of stumble, and then, but you see the people who are laying on the ground, and then 3 minutes later they get up and everybody cheers and it's great. And you're like, okay, now what happened to him? 10 years ago, they probably were back on the field, but, today, anything like that happens, especially with young athletes, kids under the age of 18, you just have to be conservative. There's no reason to not be conservative, and just, at least for the rest of that game, they're out of the game. I don't care how good of a player they are. If it's your son or your daughter, that's not important in the big picture. You need to really protect their brains.
So as far as a concussion takes time to recover, like kind of what we were just talking about, is a lot of people think you get a concussion, 24 or 48 hours later, you can be back on the field. But is that game really worth your life?
Right.
Or those neurological disorders that are going to occur because of the damage that has been done?
Right.
to their brain.
Right. Well, you have to actually, this reminds me of another kind of myth um, with young children is we used to think, kids are so resilient. They are, they're developing so quickly and all this stuff, they're going to get over it really easily. Unfortunately, because children are developing so rapidly and so many different things going on in the nervous system, those effects of a concussion can be longer reaching than, say, a young adult or somebody, a professional athlete or anybody like that.
Right, because you have rapid neurological changes, and then we're aligning that with high incidences of concussions, and the changes in the filaments that you were just talking about. That's why I found
Right.
it curious, like as children, since they are developing, could they potentially come back together, but probably not.
You know, it's it's not that they won't. Um, just nobody really knows what the long-term effects are. We have a pediatric practice, obviously here in Dallas, and we see a lot of developmental delays, developmental kinds of things throughout the whole lifespan. It's interesting to me how in a lot of those histories, not all of them, not even probably half of them, but in a lot of them, there's a history of a fall, a fall out of a high chair, a fall off the changing table, um, a car accident, you know, any number of things that just in the history you might think they recovered just fine. But, all of a sudden, as they're getting older, there's more and more issues that are showing up. But there's no way to tell, okay, is that because they had a concussion? It just is part of, that history. And we now know that some of these things can emerge much later. So again, it just gets back to you're much better off erring on the side of just being conservative and protecting
Uh,
them as best you can.
and when I don't even know how long ago it's been since I heard this, but I have always heard that if you fall from how tall you are, that you're okay. But really, that's probably just a myth, right? From the height of
Um,
how tall you are?
yeah, actually, I hadn't heard that one. That's a good one to
No?
add to my list.
Yes.
But
There you
no,
go.
I would,
Like
if
if
you
it's a
just like,
toddler.
yeah, I mean, chances are of you hurting yourself, maybe, but what if you fell from your height and you hit the coffee table with the back of your
Mhm.
head? You know,
Well,
um, it really depends on the mechanism and what happened, and it depends on, the speed that your body's going. Are you riding a bicycle? Are you in a car, or are you running on a field? All those things factor into what happens inside your skull. If you think about your brain's kind of like it's like a bowl of Jello. So just imagine you're holding some Jello, and you hit it against a wall. That Jello doesn't just stay solid. It you get a rebound, and it's with that rebound that you have the injury.
so I know you said earlier that you have worked with a lot of athletes, and I know concussion has really been on the forefront with our NFL, with collegiate sports. Kind of, what are some of those long-term effects that you're seeing that could be seen in the future with these children
The long-term effects from concussions as a child or as an athlete
as an
later.
athlete later?
It's there's a saying in schools, and most all concussion physicians purport to the same thing: 3 strikes, you're out. And the reason for that is the first concussion might not hurt you long term. You may just recover just fine, never even know the effects of it. You might even get away with it the second concussion, although there's certainly the risk there. But when you start adding a third and more concussions on top of it, those are really accumulative or have a much greater potential for being accumulative. So, if you have somebody who had a lot of concussions as a child or an adolescent, they're probably not going to make it to the professional level if they've had enough of an injury. What's interesting is if you look at in terms of who's at risk for the longer recoveries, the individuals who recover the fastest are the professional athletes.
Oh, really?
So is it because of all their strengthening that goes on, or they have thicker skulls, or they've got, more stuff around protecting them, but they're not immune either.
Right.
You have enough of those injuries. They may not, they smash into another body where a 6-year-old that could cause a concussive injury, a professional athlete's not necessarily going to have a concussion from that, but they would if they got, slammed hard enough on the ice or the ground.
Right. So the damage from concussion is what you're saying is really that damage is cumulative as it continues to
Right.
happen. And that's so interesting is if they start as a child and they have multiple concussions and then going up into their lifespan, just wondering. And I know probably the research isn't there yet because it seems like these things are things that are being realized within the last 10 years is how these effects have continued to affect people into their adulthood.
Yeah. One other thing, Candace, that's worth mentioning too is with children in particular under the age of 18, 20, whatever age you want to give it, you are at a greater risk for a second injury within the 2 to 3 weeks following that concussion. Your reaction time is off, your balance is off, your vision a lot of times is off. And what's especially dangerous about that is there's a phenomenon that can cause sudden death as a result of having a second impact. It's called second impact syndrome.
Oh,
And
wow.
you have a second impact like that within that 2 to 3 week period, you can cause enough. You hear about it, periodically where an athlete, died on the field. And you look at, their history again is, did they have a concussion a week ago? What else was going on before that occurred? And it just is the brain can't take it because it's in a healing state when it gets injured again. And
Right.
that's the other, reason for being conservative about how you reapproach sports following a documented concussion or
And
concussive injury.
And it's interesting that you say that because I have smaller children right now, and my youngest loves to play soccer. And so my husband was going to be the assistant coach there. And he actually had to go through training for concussions. It was an online training, but you're starting to see more and more, and it was a recreational league. It wasn't anything professional. But you're starting to see more and more of your sports. They're not really companies, I guess, leagues starting to do concussion training on their volunteers.
Yeah,
So maybe it's a step in the right direction.
It's a really good idea. We actually developed one that we were sharing with other, sports organizations, and our big push. This is about 8 years ago, and trying to get where when kids or parents had to go get their kids uniforms or whatever, that they had to have taken a concussion education program. In Texas, unfortunately, I don't see it as much as. It's good to know that in Florida they've got that.
Yeah, well, we did that for soccer, I have kids who love tennis, soccer, and what's the other competitive cheerleader. So, all of those are sports
Those are
where
all
you.
potential, but there's a lot of benefit to sports too. It's not like we should take our kids out of sports. You learn,
Absolutely.
you learn about your body, you learn about social relationships, you're part of a team, and there's a lot of great stuff about sports. We don't, you don't want to throw the baby out with the bathwater, as they say, but but we do need to protect our kids. And if they are injured, then we really do need to take the correct steps to make sure that they can have a safe and as full of a recovery as possible.
Absolutely. Well, we have come to the end of our time for episode 1. Please join us for episode 2, where we will delve further into concussion management, where we'll talk about the difference between children and adults, how we assess, intervene, and evaluate with concussions. Thank you so much for being here for episode 1, Sally. This has been very informative.
Thank you.
This podcast featured content from an accredited CE activity provided by Colibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.